Okay, thank you everybody for being here. I am excited to kick off this Instagram Live with a new guest. And the topic of today's Instagram Live is going to be, I think, one of my favorite topics in dialectical behavior therapy, which is the D in the dialectics. And it's timely that we're having this conversation because at TheraHive, I should mention that we are an online mental health education program. We teach DBT skills groups fully online in small group settings. We publish a lot of free resources for anybody who's trying to learn DBT. And this week, we actually published a free video, which you can find at youtube.com/TheraHive. It is the latest video that we published. It is specifically about dialectics, and the video was the creation of Jesse Finkelstein, the co-founder of TheraHive, and Andrea Gold, who is our guest today. And with that, I'm going to turn it over to everybody here to just do some quick introductions. And Andrea, since you're our guest, why don't I start with you?
Andrea.
Hello. It's great to be here. So I'm Andrea Gold, psychologist in Rhode Island, the smallest state, and past 7 years. I'm at Bradley Hospital where I work in doing DBT and exposure therapy, and it's great to collaborate.
Awesome. Thank you for being here.
So my name is Jesse Finkelstein. My pronouns are he, him. I also want to know I'm noticing that like things are freezing. Is that me or is that other people?
I'm not seeing the freezing on my side.
Yeah.
But
you're not seeing freezing on your side. Are you all seeing me freezing?
Yeah.
Nope, you're looking good.
I did. Now that you said that.
Okay, I'm gonna go off my Wi-Fi, but I want to quickly introduce myself in case Jesse. My pronouns are he, him. I am a clinical psychologist, and I also want to highlight for folks, in addition to creating this wonderful video on dialectics that Andrea and I worked on with TheraHive, it's based off of an article that Andrea and I developed for the DBT Bulletin. So you can find that at dbtbulletin.org. All right, Alicia, I'm going to pass this off to you, and let's hope that I don't disappear.
Yes. Alicia Smart, clinical psychologist in the Bay Area. I run a DBT center, and I'm also a co-founder of TheraHive.
Cool.
Okay.
So how about before we get into it, let's do like I don't know about you all. It is, Andrea, I know you and I are on East Coast. It is 6 o'clock here on a Wednesday. I've had a long day of working with patients and clients, and I could use, Roland zooming in his camera real big, Roland thing. Andrea's coming in real close too. This is a fun game that we're all playing. Why don't we take a quick moment and just practice, just like do a brief mindfulness. For reminders for folks or for folks who are new to DBT, mindfulness is very much the foundation of DBT. Principally, we sort of use it in a couple of ways. One, to sort of bring our attention to the present moment. For many of us, our days can look really hectic, and so it's a wonderful opportunity to ground our attention right here and now rather than in the past and the future. And, the logic here is that in order to change behavior, we actually have to have an awareness of what that behavior is and how it exists in transaction with our environment. So mindfulness is that awareness that we are cultivating. So let's just take it to basics. I'm going to invite everyone to either close your eyes or lower your gaze. And we are simply going to allow our attention to anchor to the breath. So inhaling, know you're inhaling. Exhaling, know you're exhaling. And allow your focus to gently land wherever you notice the breath most powerfully. your mind wanders, as minds tend to do, simply notice that. Draw your attention back to the breath. All right. When you're ready, open up your eyes if they were closed, lift your gaze if it was lowered, and let's bring our attention to this wonderful Instagram Live. As Roland mentioned, and I actually have a somewhat secret also set of questions that I also, because it's rare that we get both an expert on dialectics and someone that's working at the intersection of DBT and ERP. Andrea, I did not, and then we prepare you, but I do have questions about that intersection as a clinician that increasingly find themselves working with folks who both are meet criteria for OCD and emotion dysregulation. So, but Roland, I'll before I hijack this conversation, I'll let you get us started.
Yeah, just as one way of getting started, I just want to remind everybody who is on the Instagram Live right now that we do want to hear from you and we want to know what your questions are. We, of course, have a pre-written set of questions that are going to give you a good overview of dialectics, but we want to hear your specific questions, so don't hesitate to jump in and share those. But just to get us started, I think giving us just a brief overview of the concept of dialectics and its significance in DBT. It's obviously the D in DBT is dialectics, so it's a very central concept to DBT. So maybe if one of you could just give us that quick introduction.
Andrea, do you want to kick us off?
Well, I can give you an example. I'm feeling nerve-sighted at word that one of my teen clients taught me that means nervous and excited at the same time. So I can be both of those things, right? So dialectics has to do with multiple truths that coexist, different things. It's the opposite of an either or, this or that. I think it's one of the first things that most of us learn when we learn what DBT is. It's the D. I think it gets to how Marshall Linehan does treatment. Thinking about therapies that are focused on change weren't effective for populations. The opposite of just accepting weren't effective. And so at the same time, and moving back effectively in acceptance and change is one example of a dialectic. So I think understanding what it is and applying it, and knowing how it's at the core of treatment. And I would say it's one of the first, and 17 years now later that I've been practicing DBT as a lifestyle, I'm still learning new things about dialectics every day.
Amazing.
Alicia, I'm curious to hear, like, for you, like, how do you experience, like, Andrea, I loved how you highlighted the personal significance of dialectics and sort of holding these two emotional experiences simultaneously. Alicia, like, how does dialectics, like, how do you understand it as both the concept and its relevance in your own life?
Yeah, I mean, first of all, it's so relevant to our work as therapists, for sure. Like, I'm constantly using it. It's like a dance, with clients, constantly to be doing this acceptance change dance.
Alicia,
we just lost your audio, Alicia.
Alicia, we lost your audio. We can't hear you. Now we can hear you.
Back.
Oh, now I'm back. Okay.
You were saying it's a little bit of a dance, acceptance and change. Can you say about, like, what does that mean?
Yeah, I mean, it's like for example, one of the assumptions in DBT that we hold is like client, are doing the best they can, right? That's one end. And then we're also saying simultaneously they need to try harder and do better, right? And that both of those things can be true at the same time, right? And so oftentimes, like when we're even like what Jesse was saying, like we need to accept in a way that we're even doing a behavior or doing a thought, like, or something is happening, and accept that that is happening and observe it before we can then move toward change. So like there's constantly this dance of like acknowledging what is and then looking at like how do we change it or how do we do something different. And so that's part of that dance, right? I think oftentimes when I'm thinking about like for myself, I think as a parent, there's like dialectics that are happening constantly with kids where, you know, like I want something, they want something, right? Like we're that like middle path sometimes, or even like with parenting with a partner who maybe has slightly different parenting style than you, right? And finding that dance between, you know, how do you parent together dialectically? Right? Maybe one parent is a little bit more on the permissive side and one is more on the strict side, for example, right? And then like both sides are useful and helpful, but then like how do you find the way to kind of be together?
Yeah, one observation that I would just share is that when you first get introduced to dialectics, it can actually seem like a pretty abstract concept.
Sure.
So I think it really is helpful to give tangible examples. I like the one that you shared, which is I think of as like the central dialectic in DBT, which is that I can accept myself for who I am and love myself, and also recognize that I need to change in
Right, or
order
there's things
to,
that I want to change.
yeah.
Simultaneously.
Can you give me
And I,
some other, like the top 5 dialectics that maybe we run into just to make it more tangible for people?
yeah, I mean, I think, you know, I think for many folks who are coming into DBT, you're going to hear this concept that I'm doing the best that I can and I can do better. And I want to highlight that's not just applicable to clients, that's applicable to all humans. Like in this moment, each one of us is doing the best that we can given our biology, given what we know, given what we've learned, and ostensibly we could all be doing better. Like I'm sure that I could probably be wearing a shirt right now which is not drawing my attention to a stain that's in the middle of it. Like we could all be doing things that are slightly better. And DBT is and I'm like, I don't want to get too in the weeds of the philosophy here, but it is a deterministic sort of treatment. In other words, we believe that all behavior is caused. We might not always be aware of the causes of those behaviors, and everything that happens because of things that took place before it. And that's why we really highlight that everyone is doing the best that they can, given what they know, given what they've been taught, given their biology, and they can be doing better. And Roland, you were highlighting like there is a foundational dialectic that we're constantly sort of holding, which is acceptance and change. And from that, many other types of dialectical tensions emerge. I don't know. I like Andrea. Like, what are some of the like dialectical tensions that you observe?
So I think there's a lot of examples of all or none, black and white, about dialectical dilemmas or stuck points. When it's extreme, it's a sign, knowing that for one opposite, there's another opposite. And so with emotions, I think it's a really good example where people may feel overwhelmed by their emotions. And so they try really hard to avoid them or squash them down. But the more you squash them down, right, that may set you up for then that all. When you have the all side, when you may become your emotion or act on your emotion without other skills, that may lead to some shame and to try to erase your emotions or suppress them and whatnot. And so I think that's a pattern that certainly for people who are in DBT, but really all of us to some extent can get stuck with the back and forth. And this philosophy of dialectics and thinking about being able to figure out how to get unstuck from either pole, but be able to see both and how to hold them together. So it either I am my emotion, I'll listen to whatever my emotion says, that can come up a lot with anger, or my I need to get rid of them or act like I don't have them. I think this could come up with independence and dependence. So Alicia, you talked about parenting, especially lessons, and kind of that balance between the two and getting stuck on either side. Another one has to do with, you know, kind of accepting help, like along that independence, dependence, right? I either need to do it all on my own, or have somebody do it for me. So lots of examples. We could talk specifics, but these are some kind of themes that come up.
Yeah.
Andrea, I'm getting a little bit of your audio is cutting out just a little bit on me occasionally. If you could try to put something under the phone to just make sure that mic is a little more accessible, that would be awesome. One of the big ones that comes out for me that I just hear all the time, and I feel like I experience all the time, is that we can feel towards somebody else that like this person is maybe frustrating us or disappointing us, or we're unhappy with them, and we can also love them.
Mhm.
So I feel like dialectics comes up pretty commonly in relationships, right? Relationships trigger a lot of our emotions just in general. So I think this is another one that sort of rises to that top five that people might deal with. Like if you have a parent who, I had a parent who kind of drove me crazy, but I also loved, right?
Mhm.
And that maintaining that dialectics is something that a lot of people can relate to.
Yeah, well, and to your point, Rowan, we actually have another video on the TheraHive YouTube about a couple, right?
Yeah.
Kind of illustrating this dialectic in practice where there's a relationship situation happening, right? Where one person feels disappointed, right? Or hurt, or like this person doesn't care about me,
Mm-hmm.
right? But then holding, oh, they can do uncaring things and actually still love me, right? Like that it's not where I perceive them as doing uncaring things, but they actually may, maybe they're just tired and it
Mm-hmm.
wasn't intentional.
Yeah.
Alicia, and I feel like all of you are like, in many ways, I feel like dialectics draws so much from the lineage of cognitive behavioral therapy,
Okay.
in the respect that, like, one of our big goals is to develop cognitive flexibility. And, like, what I mean by that is it's so easy for us to experience the world in a very narrow way. It's like, we have all this learned behavior, we have all this history, and it's almost like the aperture of a camera can get very small. Like, I'm bad, that person is good, or like, like I can't do anything right, or if I ask for help, it means that I'm weak. We hold these sort of
Mhm.
these thoughts that end up narrowing our sort of experience of reality. And I think one of our roles as like psychologists is to help folks sort of expand that aperture. Like, what else is out there besides that narrow thing that I'm experiencing in this world? Andrew, I'm so curious what you're thinking right now.
Reference to Love is Blind. So I think it was the season before last where people are disagreeing and arguing, and I want to say characters, so they're real life people, but one of the people on the show said perception is reality. And I think there's a dialectic there, right? And so what you experience from your point of view, even if it doesn't fit the facts of reality, uh, makes sense. It's valid. In the video, we were inspired by this metaphor, this image of a cylinder, where based on your perspective and how you're looking on it, if it casts a shadow, you might see a square. And in that moment, right, it is true that you see a square. But someone else from a different side may see a shadow of a circle. And so I like this love is blind example, because we're not saying with dialectics that the cylinder is the truth and that's it. We are acknowledging that there are multiple truths, right? And so, I think with a disagreement, when COVID first started, when it was the pandemic, I needed my best friend to do some childcare for me. We didn't have childcare, asking her to help out, and felt like, okay, she could really do this for me. But her family was concerned about spreading the illness, and this was before the vaccine, before we knew much. And so on one side was her value of, I want to help my friend Andrea. On the other side is, we're going to follow quarantining, we're not going to spread, we're not going to do this. And there was a tension,
Mhm.
opposites. If we weren't being dialectical with each other, if we weren't communicating, we could get stuck and polarized, or she could, even within herself. I think something we talk about a lot at NEA BPD and Family Connections is the skill of collaborative problem solving. So seeing the dialectic, seeing the different truths, and then how can we address both of the problems? And so while she couldn't solve my problem by just coming and doing the childcare, what Amy did do was say, I can't do that. She observed her limit, but I want to support you as my friend. And so she spent time helping me problem solve the problem. And so I think that's a dialectical perspective. The synthesis is how can we get both needs met? And I think, Jesse, like by doing that, we're not just coming from our perception. It can kind of like help us be more free, right? And do more problem solving too.
Yeah, I like that because it is kind of encapsulating what you were saying, Jesse, like getting into more flexible mind, right? That we're trying to get away from that rigid, like I'm right, like, and you know, like as opposed to just being polarized, getting to a place of like, can I see your needs and still honor my needs, right? And getting to that synthesis.
That's one of the biggest. Roland, you asked for general dialectical dilemmas or tensions.
Yeah.
I think one that comes up a lot is when there is a mismatch between one person's wants and needs and the other person's personal limits. So as clinicians, we're trained to look at this, be mindful of it. And what happens often is people might judge other people's needs. Oh, she's needy, he's too needy. But really, in DBT, we have the perspective of non-judgmentally looking, like your wants and your needs are what they are. They're valid, they're understandable, and they're a mismatch with my limits. And so a dialectical perspective isn't saying that person's too needy, right? I have the boundaries, this is right. But figuring out what's the synthesis, what's the match between the two, and knowing that's never one and done. It's a constant process of observing and looking at it. So that's another point about dialectics is this rinse and repeat. And that change is always constant too, that I think is important to pick up here.
Right. And that synthesis is evolving over time, right? That it can be kind of an unfolding process.
Mm-hmm. I think this freeing perspective too of it not being right or wrong, I think really helps like with shame. Because if you're told you're too needy, you need too much, or your emotions are too big, who's to say big emotions are bad and less emotions are better, right? That's a judgment. It comes to that mismatch. And I think, I think we could talk more about how dialectics fits with the other skills, but we want in DBT to be non-judgmental. Doing that is a way to be dialectical, and dialectical helps us be non-judgmental, to just kind of name, okay, these things make sense. Like Jesse said, reasons leading up to it, and then seeing all the different sides together, well, we can figure out what to do about it.
Awesome. I want to just remind folks that if you have questions, please ask them. I'm looking at the feed. I see that we have a previous guest in our Instagram Live right now. So good to see you here, Kiki. I think what you shared also is a good segue for us to delve into, speaking of perspective taking, which is what dialectics kind of is, a form of perspective taking. I think it would be helpful for us to seat dialectics within the context of the modules within DBT. And just as a little bit of context for those who are watching, we have done Instagram Lives on 3 of the modules. We're going to do one more on the last module. So if you're interested in learning about the modules and getting like a 45-minute or 1 hour sort of dive into a Q&A about those, you can look at our previous Instagram Lives. But I do think we should spend 1 minute right now just helping folks understand, how does dialectics fit into or relate to the different modules within DBT?
Who wants to, Andrea, you want to start us
Sure.
off?
I mean, there's so many.
I know.
So, off the top of my head, I think if we think about with stress tolerance and reality acceptance, one way to accept reality, I think dialectics is part of that, right? So Jesse's kind of speaking to the causes of reality, and kind of seeing the different sides can be a way to practice reality acceptance, like right there. I think self-validation is a skill that can come up in mindfulness and in reality acceptance, and being able to both hold on to your experience and what you feel, and see, okay, what my emotions are telling me to do may not be effective. They're valid, but I'm not going to act on them. That's a dialectic right there, right? Those are two opposites. So in a way, it's a skill. Mindfulness skills are core, and to do any other skill, you need to do them mindfully. I don't know if I'd say you have to do every skill dialectically, but I think there's a fit, there too. If we look at interpersonal effectiveness, at any time there are 3 goals that are at odds or could be at odds with each other: asking for what I want, or saying no, or getting the other person to feel good about the relationship. And there may be a tension there in between. And so how we negotiate with somebody, again, coming back to that collaborative problem solving, we could use dialectics to help us do that too. So I've got another example, if that's cool
Yeah,
to share.
please.
I like, this is just like a simple example of the cylinder. So, oh my gosh, so many examples with my best friend. She happens to be a DBTer too, so it makes it easy to bring this stuff into our relationship. But we were at a restaurant, and I was picking out a table, and I was like, oh, this table here by the window looks cute. Let's sit there. And she was like, oh no, that's a gross table. Let's not sit there. And so there's dialectic of the table is both good and bad. And from my perspective, I was just looking at the location, the scenery. It was great. It was desirable. From hers, she noticed that there were crumbs on the table that didn't even register to me. And it was bad for that reason. And so there, with like negotiating as part of Dear Man, I could say, oh, well, why don't you like the table? And I think coming at it with curiosity, one, like if you want a quick way of how to be dialectical, ask the question, what am I missing? What am I leaving out, right? What's being left out? And so saying, not judgmentally, not like, come on, we always pick your table, but saying, well, how come you like this table? Oh, it's messy. That gave me information. And then I could be like, great, if I clean it, can we sit here? Yes. And we could both get our met. That's not always true. It's not always that like clean and simple. But that could be like looking at the things over time and bringing in my there.
And I mean, and Andrea, to your point, like, even if the transaction itself doesn't sort of resolve itself as simply as that, it can be incredibly regulating to at least begin to imagine with curiosity what it is that other person is thinking or experiencing. Because there is something, when we are polarized, that's when we notice that emotions tend to intensify. And so if you maintained in this position, oh, her opinion's bad, like no, like what is she? No, she always like picks like all of a sudden now there's anger, now there's resentment, and even just opening up like again that aperture and being like, what am I missing in this moment? And beginning to imagine what Amy is thinking and what she's wanting. You're no longer sort of turning her experience into, you're not flattening her experience. You're expanding it. And it's easy for us to relate to that and to begin to think a little bit more flexibly when we sort of I don't know, give people more texture rather than just flattening them.
Is there
yeah.
Is there an extreme on the other end of that, Jesse? Like I think one of my observations of learning DBT is that when you learn about concepts in DBT or you learn about skills in DBT, you start seeing opportunities to apply it everywhere. And I think it may be more pronounced with dialectics as a concept than almost anything else. It's like you can start seeing dialectics literally everywhere. And I do wonder if you have guidance or if you've thought about how to constrain the use of dialectics.
Roland, Andrea, this is you're leading into my Andrea, please.
Wait,
I am well, there's been this thought that I've been having, and we've addressed this on previous live where we've talked about like, you know, for folks who tend to have maybe an intolerance with uncertainty. And I can imagine at times dialectics and thinking dialectically can prove to be a potential source of rumination. Or like, I'm like, okay, am I seeing both sides? I'm curious. Andrea, I'm sort of curious how you navigate this.
So a few things. So yes, right. Sometimes being dialectical or too dialectical means you're not being dialectical anymore. Or the way to be dialectical is to just stay on one side. So I think.
Can you say?
Yeah, can you explain that?
Can you say more about that first part?
I love hearing this, please.
So if I'm always looking for, okay, what's this side, this side, this side, right? Well, sometimes people will get excited about but reduction, right? So there's the whole, I say a sentence, blah, 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 but blah, blah, blah. And the but negates everything that comes before it. Like, hey, Jesse, I know you really worked on that hard thing, but, you know, could you have done it a little sooner? You know, that kind of thing. What is Jesse hearing? Is he hearing, I know you worked hard on that thing? No, right? You're just hearing the end. And so people, when they're first learning dialectics, come in with and, right? Replacing the but with and. When you're doing that, great, that could be helpful. But you want to make sure that you're actually doing that. And sometimes the way to be dialectical is to say the first part and stop, period, pause, hover. Because if you move too quickly to the other side, right, that may not be the dialectical thing to do. And so that's one piece of it that I would say is sometimes you need to just spend some time on one side before going to the other. And that's the way to practice dialect, because moving quickly could invalidate the other side.
And that's so I like when I'm thinking about this now, it's like, of course, it's like when we're teaching validation and we're teaching folks how to validate themselves or others, we really, and I say this oftentimes, like working with parents, where it's like, okay, we're not, okay, validate, and there's such a strong urge to validate and then to begin to problem solve. And it's just like, no, we're staying at this end of the dialectic right now. We're not focused on this other end.
And right, we also, the other thing in the video that people will see is this idea of Venn diagrams to represent dialectics as a common visual representation. A dialectic is not a 50-50 mix of two sides. It depends, right? So that's one way I think we could go awry with being too dialectical. Another way, and this is Jesse, with your point about intolerance of uncertainty, is sometimes we may want to try to solve all the problems or see all the sides. That can lead to willfulness. So willfulness shows up within distress tolerance, reality acceptance, of where our goal is to practice willingness over willfulness. I like to think of willingness as willing to succeed and willing to fail, like an open mindset, accepting reality as it is. Also, I like to think about it as, are we allowed to swear on here or should we not?
Yes.
Fucking hey, do it.
I really, really, really don't fucking want to do this thing, and it's effective, so I'm going to, right? Thinking about willingness. Willfulness could be fighting reality. It could be being in denial, not doing the thing. Other people, especially people who run anxious, can go to the other side of willfulness of trying to control or fix everything. Mm-hmm. And so anxiety as an emotion, unjustified and ineffective, can try to get us to control or make perfect. And so if you kind of go wild with dialectics, that could actually lead to reality non-acceptance. Is this making sense?
Yes.
Yeah.
Roland, I feel like Alicia and I are steeped in this, and so I'm looking at you as some like how are you hearing what Andrea is saying?
Yeah, I think that there's just an expression that is coming to mind for me around this, which is one that we hear all the time, which is called analysis paralysis, where I feel like, I think your comments have addressed this to some degree, about the fact that in our pursuit of dialectics, we can become kind of like over-rotated on dialectics to a point where it can be difficult for us to do the synthesis work. Like we can get pretty focused on understanding doing the perspective taking, but not doing the second part, which is the synthesis, which is actually coming to some kind of decision or conclusion or a path, some way of moving forward, basically. And I think what I heard you say is like willfulness can be the thing essentially that is sort of like blocking us from making that transition to synthesis. Mm-hmm. Is that a fair replay?
I think that's certainly part of it. I think that not getting rigid about being dialectical of saying I've got to see every side, like I'm riffing off of what you said earlier, Jesse, is not being dialectical. I think another way to put it too is, at the beginning of this conversation, Alicia and Jesse spoke about the dialectic of we're doing the best we can and we need to do better, try harder, be more motivated. That showed up in the first edition skills manual. In the second edition manual, there's an asterisk next to it. And so rather than you always have to be doing both, Linehan added in the second edition next to you got to do better, try harder, and be more motivated to change, unless, you know, progress is good and there's a realistic rate of improvement. And so I had to stop myself when Jesse was talking. I was going to be like, it's not always do better. Sometimes you don't. And I think this just, Roland, your point about how does this fit in other skills, effectiveness is a mindfulness skill, doing what works, that we want to balance together.
Okay, great. I think I love this conversation. I feel this is really helpful, I think, for people just to understand. I mean, I'm reducing things to well-known statements here, but like there's a little bit of everything in moderation here. Like,
but
and
no,
Balance.
but Roland, but
I think
yeah,
I like
yeah.
to think of it all about like what's actually going to work and what's actually effective.
Yeah.
And so bringing it back to effectiveness.
yes.
Because to your point, Andrea, like I definitely have had the clients that are like so focused on doing better, trying harder, like that they almost burn themselves out, like with their constant driving. I need to do better. I need to do better, and not enough acceptance, right? So
Well,
it is a balance.
Sometimes the way to do better is to take a break.
Totally,
Mhm.
100%.
For yourself, like you're saying, Alicia, for individuals, but this comes up so much with parents. I had a mom this morning in family therapy say, I just want to fix it for him. I just want to fix it. And, you know, I think paradox is something that comes up a lot with dialectics too. And this idea, the way to fix it, the way to support your kid and love them and help them is actually to
Let them
not
fix
fix
it.
it for them.
Right.
Yeah.
I-
Totally.
Wait, can we just repeat that? Like, I just feel like for many parents that could potentially be listening to this, I think this is a really important point to highlight. Would you guys just say this one more time? This paradox.
This idea, and I think this fits in with dialectics, but also lots of other skills, is often people make errors of kindness. So coming in, trying to fix, problem solve in a way that's just not helpful. I think that, you know, this comes up a lot with emotions. And so, you know, if people are wanting to help the other person, but it's not effective to do that, or it's not a problem that can be solved, right? The thing to do is to support, to validate, to not change. So I think dialectics also helps us thinking about acceptance versus change and when which one is effective and to balance it over time. I really love the dialectical phrase, you got to go slow to go fast. And that with a dialectical perspective and mindfulness and all these skills together, sometimes the way to go the fastest is to actually slow down.
Yeah, I love that too.
Can I, and Roland, I just, because I, only be a little nitpicky. You mentioned earlier, like, moderation.
Yeah.
And in fact, that's not, like there are times where, again, we want to be sitting, like, where it's appropriate to sit on the other end of, like, not being moderate. Like, if I'm at a party, I don't want to be moderate in terms of, like, if I'm dancing, in terms of, like, my joy or what have you. Like, that is a time in which maybe emotional disinhibition, I can really be landing on that unmoderate pole, if that's making sense.
Because it's
Andrea,
effective, right?
yes, because it's effective. To Alicia's earlier point, it's like, what is going to be effective?
Yeah, I think I meant it in the sense of like what kinds of internal signals or monitors could alert me to whether or not I am using a skill effectively. And I think that like if you're using it all the time and you feel like it's become a constant endeavor that you're constantly trying to find the dialectics and everything, that might be a signal that you're over rotated.
It depends.
Yeah,
it depends.
My answer.
Is it effective? You would just say, is it effective or not? Like if you're using it all the time and it's also effective, maybe that is okay.
I can give you an example of that, a personal example. So I went through a year of breast cancer treatment that was absolute hell, that had a ton of physical pain, a ton of emotional pain and suffering. And dialectics is probably what I used the most. I used all the skills all the time, but my goodness, did that show up a lot. And there were times where it made sense to sit out on one pole, right? But I think that was being dialectical in that instance.
I love that
Andrea,
example.
do you, and feel free, like, I'm just, would you mind just speaking a little bit, like, how dialectics became a skill that you really drew upon?
Absolutely. So another place that dialectics shows up in our modules is within distress tolerance, the improve the moment skill. That's a fun one that kind of sits at the synthesis within distress tolerance. We have the two sides of crisis survival, tolerate, get through, or reality acceptance, which is accept. And there's a dialectic right there within distress tolerance, moving back and forth between getting space from the pain, tolerating it, surviving, versus getting up close and personal. And I like this idea. Not all people who learn DBT learn this, but I learned it from my mentor, is that with distress tolerance, you're going kind of back and forth between the two. So the improve the moment skill, the M, is making meaning, which is a dialectic. And this actually shows up as one of our dialectical strategies, making lemonade out of lemons, right? Finding the meaning in the pain can be a way that no matter how painful your pain is, that can bring up one's ability to tolerate distress. And it certainly did for me all of well, the past 2 years, but especially that 1 year, 2 years ago. And so, you know, just saying, oh, you've got cancer. Look at all these lemonade. Like, look at the lemonade you can make, can be invalidating. But not finding the meaning, right, can be missing opportunities for coping and thriving for people where it's effective. So I do not want to say that this skill is for everybody, because that would not be dialectical. But to think about, the silver lining on the rain cloud, Marcia teaches this as, it's not just saying, oh, just look at the silver lining. It's look at both. The rain cloud is there. It's stormy. You're wet. It gets in the way of doing the things you want to do. And look at this beautiful silver lining. One of my favorite dialectics is a quote that I learned from Seth Axelrod, who is my DBT mentor. He passed away from cancer actually the day before my diagnosis, which was just wild timing. And at his funeral, his loved ones shared a quote that he would say, as bad as it is, it's as good as it can be. So that's a dialectic right there, right? What I like about it is it's not just, this is horrible, this is miserable. It's taking the accepts skill of one of our crisis survival skills. The C, downward comparison, is, well, look what I do have. And actually, when I broke my ankle, when I trained with Seth, I remember we talked about it, and he was saying, like, okay, well, I broke my ankle and I get to walk, right? That would be a downward comparison. It could be worse. And that's a dicey skill for folks, because just saying, well, other people have it worse, can be really invalidating. So that it's as good as it can be is in the context of acknowledging how bad it is. And so in cancer communities, I think in communities of people with BPD and emotion dysregulation, this idea of toxic positivity comes up, which is also not dialectical, of, oh, you're strong, you're fine, everything's going to be okay. In treating anxiety disorders, that reassurance of everything's fine, it's okay, can also be a problem. It's just one side, it's absolute, it's all or none. And so kind of looking for, for me, my cancer was stage 3. And so it's as bad as it is. Stage 3 is bad. It's as good as it can be. It's stage 3 and not 4. So I really like that as, is that a skill? Is that a mantra? What is it? It's a lifestyle. And then finding ways to link it to behavior.
Yeah. I think one of the ways in which you describe linking it to behavior, it also sounds so much like ERP in this respect. A moment ago, you described this sort of this dance between moving towards the thing that causes us pain or discomfort, and then moving at times away, and really calibrating what's going to be effective.
Yep.
And I'm wondering if how you, and if you do think about dialectics within exposure and response prevention.
Yes. I mean, one way to set up an exposure is, we don't want it to be too easy. We don't want it to be too hard. Those are two extremes. There's our dialectic, too easy, too hard. We want it to be hard, hard and doable, or I like to just say hard but doable. I say the B word in there, but hard but doable would be one example. And with the dialectic, kind of, if you're setting up an exposure, look at, okay, what are the things that are challenging and what can I do, and kind of find that middle. And then it comes back to another thing that dialectics reminds us of is change is the only constant. So once you make some progress and you get used to one thing, well, then you move on to the next one.
Yeah, it's like the titrating of the, like, as you're getting more comfortable, right, you're kind of pushing the boundary of getting uncomfortable again to then like be able to build on that. Yeah.
I think
I do like this. I was going to say, I had not heard this quote before, but I wrote it down. As bad as it is, it's good. I really like that. I'm going to hold on to that. That's really a nice phrase.
Thank you for sharing that. Yeah. The other one that came up in general was, I don't like this one as much, but it's got its value. The good news is the bad news isn't worse, right? And I just think it's the holding both sides is really hard to do. And I think when you go to one side, well, it feels like you're invalidating the other. So then you go to the other and you're doing that one. And so Alicia, you starting with the word dance, I think is so quite fitting that you're kind of moving back and forth. I think that comes up a lot in the family therapy that we do. If you validate one person, you're invalidating the other. And so being able to take a step back and see both can be really powerful with validation.
Right. Yeah, I'm just thinking about in terms of the family dynamics too, of like, I can often see like, oh, it's all your fault, or people go to the place of, oh, it's all my fault, right? And that self-blame, right? Where it's like, it's actually an interaction. There's a dynamic happening, right? And then seeing both parts and how they're coming together. Yeah.
I think building on what you're both saying, and I want to sort of highlight this other aspect of dialectics, Andrea, that you first mentioned, which is like change is a constant. And I've been doing lots of work with parents recently, so this is very much top of mind for me. Also, as someone who's not a parent, I don't struggle with this thought in this way, but in other ways. But like, I'm a bad mom or I'm a good mom, which are, those are both judgments, and what they're also fixed. There's a fixedness that doesn't recognize the reality that change is the only constant, that we are not one thing. Like, I'm not a good therapist, I'm not a bad therapist, I'm not a great therapist, and I'm not a shitty. I'm like, this is a behavior that I engage in that sometimes is effective and sometimes is not. And I'm just curious for both of you, I know that both of you work with families, like, how do you introduce dialectics to help loosen people's attachments to some of these labels? I don't know, Alicia.
Okay, yeah. I wasn't sure who was going to take it. I think there's lots of different ways. First, I think oftentimes getting away from this place of like all or nothing thinking, right? And so holding, are there times when you're thinking differently about yourself, or other examples, right? And you can look at a little bit of like, well, what is happening in those moments when I'm thinking of myself as a bad mom, right? Like, how am I coming to that conclusion? Like, are there times when I'm thinking I'm a good mom, right? And then like, can both things be true? Like, at times, maybe I'm not doing what I want to be doing, right? And I'm labeling it as bad because I have judgment about my behavior, or judgment about how or fear that I'm harming my child, or that they're going to turn out in a way that I don't want them to, right? Or I'm holding myself responsible for how they're behaving, and it's all my fault that they're doing these things, as opposed to seeing there's lots of factors at play. I have maybe an emotionally sensitive kid, and if they weren't as sensitive, this kind of parenting style would work totally fine. But now, because I do have a tulip in a rose garden, I need to treat them differently, like, and actually parent the child I have, not the one I thought I had. So there's lots of different ways to kind of help parents start to think about these concepts and step back and see it more broadly.
I like, Alicia, how you kind of acknowledge things that can make it hard to be dialectical, to validate. And my goodness, these examples, we're not just living in the moment that exists, we're living in all the past and all the future. And so if we think about dialectics can help us to do other skills, I think being mindful, coming back to that first thing Jesse walked us through, right, can also be helpful to get us to dialectics, and to just being able to observe and describe that these are worries. I think another aspect that I bring in is to kind of like start with validating that the judgment isn't effective, the I'm bad isn't effective, it's not true. I don't even know what their parent is. Like, does it give us actually that much information? And why does it make sense that I'm having this perspective? Dialectical assessment is a strategy we don't teach to clients per se in our skills manual, but we as therapists practice. And it's that what's being left out, and why does this make sense based on kind of bigger systems, society, structure, history, things like that. So that's another way that we haven't even mentioned that we could practice being dialectical.
I want to be just conscious of time here. We've been talking for almost 15 minutes, and I feel like we could talk a lot longer. We got 10 minutes more. I thought maybe we could address a couple of questions about where. So before we talked a little bit about, we touched on some of the areas where people can get tripped up with dialectics. I think it's good for us to explore that. Maybe a good way for us to bring this conclusion to a close. Let me just ask, I'm kind of curious to hear from you where you see individuals struggling with dialectics and what guidance you might provide people. I'm personally interested in also hearing a little bit about, hearing you speak to the relationship between dialectics and another DBT skill called check the facts. Mm-hmm. Because I see check the facts as a perspective taking tool. I also think one of the tensions that I've heard when we've been talking about dialectic that I think is there, but we haven't explicitly talked about, is that we've talked about the fact that in perspective taking, we've shown that there can be multiple truths. And yet I think a lot of people feel like there is some ground truth or reality that we have to mutually accept to navigate the world with other people. And I'm curious, just like that speaks a little bit to check the facts. I'm just curious, how do you navigate, if you have somebody come to you and say, yes, but there's this ground truth, how do I reconcile that with dialectics? And how would you respond? And what other kinds of problems do you see people run into?
I want these guys to answer, but I'm going to give you the one word answer to your question. You ready? Yeah. Curiosity. Mm-hmm. Really coming and responding with curiosity. What do you mean by that? Fleshing it out. This takes longer when you're being dialectical, when you're being mindful. I had actually my former boss, when I brought DBT into our exposure program, was like, yeah, and Andrea's team, things just seem to go more slowly. and like how they spend a lot of time on this different stuff and how it pays off in the end. How it actually gets us to places quicker by going slow. And so I think curiosity that's not a named DBT skill. It should be. It shows up everywhere. But
I love it.
You guys say more to it, but that was my one, if I had to just give a one word answer.
Alicia, this is a complicated one for me. And
I felt like your question, Rowan, had so many different parts. I'm trying to figure out where to go.
Maybe start with just the check the facts piece, because that maybe part is easier.
Because I think that there is potentially a dialectical tension here, which is, and I actually would really love, Alicia and Andrew, for you both just help me figure out what this, because this is something that I personally struggle with, and I would love some consultation. So, there are these poles, which is, there is reality, whatever, as it is, right? Mm-hmm. And then potentially at the other end is each individual's experience of reality, mm-hmm, as it is. And so there are times, I imagine, where perhaps sometimes some folks may land in maybe they have a clear approximation of reality, quote unquote, as it is. I don't know, but do you all see where I'm headed with this? at all? Am I making any sense?
Well, I do think that is a dialectical tension that you're naming, right? Because in DBT itself, in a way, right, because we're radical acceptance, accepting reality as it is. And to your point, do we even see reality as it is, or do we see reality as we are?
Yeah.
Which is the love is blind quote, right? Perception is reality.
But then there's this tension in that there is some sort of reality that connects us all. Mm-hmm. I like it is
I think one part of it is it's not fixed, it's not static. That's a theme that came up, that it's evolving. You could never walk in the same river twice, whatever, right? Mm-hmm. That's a good example. That's another piece. I'm gonna riff off the check the facts question, and then we'll come back to your Jesse and see how this evolves. Oh my gosh. Sorry, side note in the back. One of my favorite dialectical strategies is called allowing natural change. Yeah. I think embracing the I don't know is being dialectical. And this idea of we have to have answers and structure and know things versus only constant, it's natural, and being open to things evolving in ways we can't predict, I think is a really helpful way to be dialectical and a beautiful like fruit of practicing dialectics. But the check the facts thing, Roland, I actually think, right, on the one hand, it's like probably a good thing that I am having to hold my phone up, because everything I'd be showing you like two hands. I mean, I think that's what we do a lot as DBT therapists, is we'll do this hand and then the other hand at the same time. And sometimes you need more than two hands. I'll use stuffies in my office with the teenagers. I'll hold up different stuffed animals. But with check the facts, right, on the one hand, we're saying, is it a fact that you can observe and it fits the facts versus an interpretation? And if it's an interpretation, I think the meat there is, I think it ultimately comes back to, is it effective? And so I get my most mileage out of check the facts as a setup for exposure. If the emotion is telling me to do something and it fits the facts, it's effective, right? Act on that emotion. If my nervousness in starting this Instagram live, if I was nervous because my house was on fire and there was an actual threat and my anxiety was saying, don't do this Instagram live, get out of the burning house, what should I do with that fear, Roland?
Get out of the house.
Right?
Right.
However, if my butterflies, if my nervousness, I don't know how to do this whole Instagram thing and hold my phone, or what if, we didn't prepare the questions, I don't know what's going to happen. Jesse added that extra layer of OCD, which is uncertainty. I wasn't expecting it, right? That brings up my anxiety. Does it fit the facts? Is there an actual danger to me? Not really. It's not what my body or my mind might catastrophize. Is it effective? Well, again, actually, to know it's effective, one thing is you got to kind of observe and describe reality as it is. So that, Jesse, comes to your point about what is reality, but what's happening now and what's in your wise mind. So we haven't even talked about wise mind, my goodness. And that's a dialectic, right? The wise mind is a place where we're in touch with our values. And I think for values, we need both emotion and reason. So my value is to do this kind of thing, to not do it perfectly. I think, Alicia, your dialectic about people striving to do it well versus whatever, I think I love good enough as a dialectical synthesis between the two sides. So that, okay, that's my anxiety. Check the facts. It's not justified. It's not effective. I act opposite and I throw myself into this Instagram live, and that works. So I think that's a place where I find the most out of check the facts. And I can see how you could get stuck if you're into like, well, you're saying it's an interpretation, I shouldn't listen to it, but then you're saying there's multiple perspectives. So, yeah.
I do often find that for check the facts, like it this might sound like heresy, and so I really want to push back here, but like I fundamentally, for me, it is about what's effective, not like I'm not like, and especially for folks who have sort of various compulsions around tolerating certainty, like this picking apart of like what is fact. I'm like, to be honest with you, like, and this is like, I don't really give a shit what the fact, like, is this helping you? Is this taking you, moving you towards your life worth living goals? Is it not? Like,
there you go.
Facts, not facts. I don't care.
So it's asking the question, and I think this comes up here, everywhere. WTF? What's the function? Right? That's another way to say, is it effective? And so is checking the facts. Sometimes people will do check the facts in form rather than function. And so getting kind of rigid about it, or even using that as reassurance in a way that's not helpful versus using it in a way that's effective. And that's where Jesse's like, I don't care. It depends. Does it take you towards or away from your life worth living?
Oh,
We are
fun, and I pretend maybe Andrea, I would like to continue this
I was going to
conversation
say,
forever.
maybe we should have a part 2 of dialectics.
Yes.
Cool.
More to talk about.
awesome. Well, we've spent an hour digging into this topic. This has been super fun. Thank you for being here, Andrea.
Can we wrap up with,
Yeah.
I know I'm not the moderator, but can we wrap up with like each person sharing like one of their favorite dialectics?
Yes.
Sure.
You
Would you like to kick
Andrea, since it was your question, Andrea, you have to start.
Dialectic.
It's hard to just pick one. I think that As Bad as It Is one. I think I also really love The Only Way Out is Through. Like the only way out of hell is through. The only way out is through. Is a very powerful, helpful dialectic for me. Jesse, I'll pass it to you.
I think one thing that I've been thinking a lot about is I think that there's a dialectic between certainty and uncertainty.
We can spend an hour on that.
Our brains are built to predict and tolerating that we just don't know what's going to happen. So like that tension I think is fascinating.
I mean, we could say the only certain thing is that there's uncertainty.
Right.
Yes.
Yeah.
And we still need some measure of predictability in order to make action.
When it's effective.
When it's effective, okay, there's lots of dialectics. Alicia, what is yours?
I mean, there's so many, but I think really the one that I kind of feel like I often am dancing with clients is this emotional acceptance and emotion regulation, like that dance.
Yeah.
Like being with feelings and really feeling them and regulating them and using other skills. Yeah.
That's got to be in the top 5. We didn't name that one, but that's got to be a top 5.
Top five. Roland, do you have a favorite dialectic?
I think the jury is still out for me. I feel like I'm still a student of dialectics, and I'm not sure that I've formed the one that I think about most is the core dialectic that we talked about at the very beginning, which is just the acceptance and change. That one I just feel like is, for me, it feels like hierarchically different than some of the others, just because it's so, I don't know, it's so overarching and foundational and about who you are. And so it's also one of the first, it's probably the first articulation that I heard in relationship to DBT. And so I think it's just because of that, it's kind of stuck in my consciousness.
There you go.
Yeah. Right. Well, thank you again for being here. Thank you for helping us wrap up that way. And just a reminder to everybody who's here, because we get this question a lot, these are recorded and they will be made available. You can see them through Instagram. We post them to YouTube as well. And I hope we as a group will have an opportunity to continue this conversation and explore further. With that, let's say goodbye.
Thank you. Bye.